Welcome to Symptoms to Stories, the podcast where real experiences meet real solutions. In today's episode, we sit down with staff from the Healthy Minds Policy Initiative to explore how their work is shaping mental health access, improving patient outcomes, and strengthening our healthcare system. From data-driven strategies to community-focused advocacy, we dive into the crucial role that policy plays in supporting mental well-being. Without further ado, let's dive right in. Enjoy!
Hi everyone! Can you start by briefly introducing yourself and then just explaining your role within substance use disorder policy initiatives?
Yeah, so my name is Tane Webb. I'm the Substance Use Policy Fellow at Healthy Minds. I coordinate our overdose prevention learning communities and then provide policy analysis and policy support for a variety of substance use issues, from harm reduction to medication for opioid disorder.
And I'm Audra, and I'm a community initiatives manager here at Healthy Minds.
That's really cool. So are there some recent trends that you've observed with the opioid crisis in Oklahoma? And are those trends unique to the state, or do you see them reflected nationally?
Yeah, so one of the things that we have noticed, there are things you hear about in the news a lot in terms of cross-contamination and adulterants like fentanyl. That is all true.
I also want to point out here that stigma also plays a large role, and that's not something that's specific to Oklahoma, right? So substance use disorder is interesting, and I would say specifically speaking to opioid use disorder, and I think this is broader, but the person is stigmatized, the treatment is stigmatized, and the condition is stigmatized, right? So people are getting it from all angles, and people, when there is a quite punitive framework to the way that we treat people with substance use disorders, people are going to be less likely to go into treatment, right, or seek help. Mm-hmm. And so I would say that's another really important barrier for people at this point. And I think we've come a long way in the language that we're using and the way that we frame substance use disorder as a disease of the brain, just like that needs to be treated just like we would treat someone with diabetes. As far as some other trends from 2019 to 2023, Tulsa's overdose death rate actually increased very significantly. So it more than doubled during that 5-year time period. And we also saw methamphetamine overdose death rates increasing significantly during that time period as well. What we saw the sharpest increase to be was the fentanyl death rate. Mm-hmm. So over these 5 years, the deaths from fentanyl are actually 21 times higher, or grew by 21 times. I think that there's also a question of data there, right? Mm-hmm. Because we are better able to collect data from our more urban areas. So we know, at least within the past few years, that Oklahoma has some of the highest HIV and hepatitis C rates of infection in the more rural areas of the state. So we know, you can't exactly parse that out, but that is highly associated with injection drug use, right? So we know that it is a problem, but we don't, when there's not a big sample size in some of the more rural areas in Oklahoma, it actually doesn't show up in the data. So I do think that is a key piece that we're kind of missing there, because we can't come up with demographic information or, and whatnot unless we know who is most affected. That's also an issue for people experiencing homelessness, even in the more rural areas where it's very hard to track, to keep up with them. And, they may not have an address to be able to put down.
How do some of the other social determinants of health intersect with the overdose crisis in different communities, like both in Tulsa and just in the state?
Yeah. So, again, these are going to be kind of themes, I feel like, when we talk about challenges in access. But in terms of like social determinants of health, I think some of the biggest ones that we hear about or interact with in our research or facilitation, definitely like healthcare access and quality, neighborhood and built environment, and social and community context kind of all combine. And so we see those commonly cited issues with distance and transportation are huge, even in like an urban area like Tulsa, which theoretically, has access to public transit. Like, it is not comprehensive enough. It is not reaching the parts of town that people would need to, have a reliable and fast bus route, for example, to the place where their appointments are. Another big one in terms of like healthcare access and quality, like Tane mentioned earlier, just making appointments accessible to families and people who are working. That's something that when we talk to people both in kind of the adult mental health care and the children's mental health care realms, both cite like appointment times, like especially if parents or caregivers are working or if students are in school and they need to be in their core classes. It can be really difficult for people to just access appointments that are at a time that works for them. We also know Oklahoma has some pretty severe provider shortages, especially specifically psychologists and social workers. So that contributes to access. And then one of the big ones that you hear about in Oklahoma is adverse childhood experiences, or ACEs. I don't remember the most recent ranking, but Oklahoma always ranks like top 5, maybe top 3 in terms of ACE prevalence in the United States. And then something that one of our partners who we work with a lot pointed out that I thought was really important. Like, she works specifically in substance use disorder treatment. Something they've started surveying patients on is not just their adverse childhood experiences or childhood trauma, but also the ongoing trauma and the context that they might be re-entering, like once they leave treatment. And so that's something that can, depending on someone's social and community circumstances, can continue to impact them and their kind of treatment path, even after childhood. So specifically in terms of like data and overdoses, another tool that we use that overlaps really well, I think, with the social determinants of health is the social vulnerability index. And so social vulnerability index is kind of a collection of indicators in different domains like poverty, transportation, housing, that kind of can shed some light or illustrate community level issues or stressors. So one of the things we found in our assessment was that zip codes with the highest number of overdoses had a high social vulnerability index. So again, it just kind of provides that illustration of how those things overlap.
Yeah, that's really important to consider. I also remember reading about like the zero overdose community on like the Healthy Minds website. Could you please like explain a little bit more about that concept?
Yeah. So the zero overdose learning communities emerged from the methamphetamine treatment continuum steering committee. And so there was an awareness and an acknowledgement of the rising levels of methamphetamine involved deaths in Oklahoma. And so there was a sort of a concerted effort there to figure out, what we could do to address that. So the learning communities were launched in 2023 under the idea that, for every person in Tulsa who dies of an overdose, it was a missed opportunity for our healthcare system to intervene and provide care. And we really now are looking to expand where we don't believe that it is the role of just healthcare systems to be doing this work. What it's really going to take is a community-wide effort to eliminate eventually overdose deaths in Tulsa, which I will get to that in a bit. But originally, our curriculum and the concept was informed by the zero suicide framework, which is often used in healthcare facilities. It's a 7-element framework that they can adopt to work towards eliminating suicide deaths of their patients. So when Healthy Minds first looked into the zero overdose concept, we found that there was actually a national organization called Zero Overdose that was doing this work. And we worked very closely with them to incorporate their programming and materials into our workshops. And so 2 of their primary materials or that they have developed are called the risk screener and the safety plan. And so they are actually, screeners and documents that can be incorporated into healthcare facilities. And so the facilities were our original target there. It became apparent over time that what we really needed to do is sort of make a shift in the way that we approach this to bring in more non-traditional stakeholders. So think people who work in housing. We just recently had a cohort with city employees from across a wide variety of departments within the city of Tulsa. And we also have worked with a couple of advocacy groups as well. And so the idea is that we have shifted from primarily, a healthcare response to facilitate cross-sector collaboration across the city to really get everyone working together to address overdose deaths. So as you can tell, we've just sort of been adapting and learning as we go, and sort of, shifting this program to meet the current community need. We have since then decided to focus more on local speakers. And the idea there is we want to let people know what their resources are that are available to them, and to find people that they can potentially partner with. The idea is really just to present the information and then to provide a space and support as needed to help people brainstorm how they can incorporate these practices into their organizations. I think one of the big successes of the workshop is that we're taking local data and sort of just more broadly information about addiction to people who may not be as familiar with this work as folks that we have previously interacted with. And so I've personally found it to be really a privilege to have conversations around stigma and about the root causes of addiction, and how it, makes physical changes in the brain. So what we have experienced is really wonderful reception by the community. People are energized. People are very interested in connecting with each other and moving forward with this work. And we've really seen, throughout the training, a shift in attitude on, the surveys that we've done, where people are indicating that they are, more receptive to, certain evidence-based practices that, people who aren't immersed in this work might not come into contact with.
Yeah, absolutely. And then to end on a hopeful note, what's been like a light at the end of the tunnel with regard to this issue?
Yeah, I think we have a few things. So I think one that we are kind of in the thick of right now at Healthy Minds especially are all of the opioid abatement grants and funding opportunities that we've seen both from the Attorney General's office and from Tulsa County. So we're kind of finally at the point where the funding from opioid lawsuit settlements is actually getting to the counties and cities and schools and other organizations in Oklahoma, and they can finally benefit from that funding. And so the types of projects that are being funded, whether they're treatment or education or naloxone distribution, like all of those are kind of part of the effort to help repair some of the harm that the opioid epidemic had on Oklahoma and communities in Oklahoma, which is, it's just exciting to see people be so excited about that and be passionate about kind of figuring out what they can do in their community to, again, kind of really try and start repairing some of that harm. And then also, just it's a great opportunity to encourage cities and schools, especially, to think about upstream preventative measures to create healthier communities and really invest in evidence-based programming and practices to do that.
Yeah, that's really wonderful to hear. Well, thank you so much for joining us for the interview.
That brings us to the end of today's episode with the Healthy Minds Policy Initiative. Their work shows how policy, data, and collaboration can truly reshape mental health access and outcomes, reminding us that when we understand the systems behind care, we're better equipped to support the people within them. And that's what we're here for, because at Symptoms of Stories, we put the public back in public health. Thank you so much for watching this episode, and stay tuned for the next one.